Health Engineering Department, Madhya Pradesh.
Honorable Chair, co-chairs, members on the dais, dignitaries on the dais, off the dais, only what gets measured gets managed. Yes, I'm going to talk about some of those initiatives from Madhya Pradesh where in Jal Jeevan Mission we have been trying to understand, and several of our speakers have mentioned such challenges for which we have tried to see how much we can make from our own side. Some of those initiatives, I'm going to talk about them. So in Madhya Pradesh, we have to cover about 1 crore 11 lakh households. We have been able to do till now about 75 lakh FHTCs, and we have both single village schemes and multi-village schemes which we are trying to complete as per the schedule. The first and foremost initiative, and everybody is talking about the same, that is Gati Shakti. So Madhya Pradesh is one such state, and I think we are one among those two top such states which have been able to do a lot of such work on. We ourselves have come up with one such mapping, asset mapping thing called Jal Rekha, and you can see here that intake wells, WTP, pipelines, over tanks, the entire, all of these, we have already done a GIS based, we have designed a GIS portal called Jal Rekha, and we have integrated the API with that of Jal Shakti, PM Gati Shakti. Recently, our Chief Secretary has issued an order to say that all future projects of more than 20 crores will be designed and planned only on the basis of PM Gati Shakti. So it is a very good initiative, and I would appreciate that Jal Jeevan Mission has already taken up this particular task. And you can see that most of our components, we are moving on to the PM Gati Shakti. Anushravan model is another such thing where the request for inspections both from our own field staff and contractors. So this also is another such app which we have developed to ensure that whatever work is happening and the inspections that are mandatory and needs to be done, we cannot just like that hope that such inspections will happen and also they will be redressed. So we need to have a mechanism as to how to redress these inspections. And you can see clearly the data on a monthly basis. We have been absolutely trying to improve our inspections and also resolve them. DARA is another module for maintaining and monitoring detailed volumetric data for all water supply schemes. Here I would like to mention that the most important task for all of us here is to measure as to what is the amount of water, drinking water, potable water, the water that we all feel quality-based water is actually reaching our households. So first challenge that all of us need to understand is how much water is actually being pumped from the sump well to the overhead tanks and from the overhead tanks to the households through those valves. So here lies the challenge, and this is one such module which we have integrated with the Panchayat Darpan portal. And the bulk water bill generation and collection from Gram Panchayats is done through this particular app. Even water charges from citizens also is being for payments for the users to, first of all, they need how much water they are getting, and the water charges that needs to be collected from the also is being monitored through the Panchayat Darpan portal, which is being integrated with the one I mentioned. We have developed a new GIS-based tube well management system, and this we have been seeing a lot of deaths happening in the, when children fall in the bore wells, the closed bore wells, the unused bore wells. During such occasion, we try to understand that we don't have a tube well management system. So we need to have newly dug tube wells which needs to be monitored, we need to have that data so that we can monitor them well. This is when we actually develop this new tube well management system, and it's GIS integrated, and we are trying to see to it that this data is being updated regularly and also being used for our purposes. Inventory management system, this is another such initiative. We have stores in our departments, and during some of those inspections, my regular inspections, I found that the data, the amount of material that is actually spread out in the stores and the actual data doesn't correlate. And that is when we pondered upon to ensure that we need to have an inventory management, and you can see that we used to have such manual indent generation, old ways, which we have now tried to convert everything, and now we have online indent generation, verification by the engineers, and then issuance of the material. Everything is now done through these apps. So some of these digital initiatives which we have tried to do during the execution stage, during the operation and maintenance, the HR management, and several such inventory management, and these are some of the initiatives which we are trying to do in Madhya Pradesh, and I'm sure few such more initiatives also need to be taken up. During my discussions the entire day with our Government of India officials also, we've been trying to ponder upon as to the actual volumetric data pertaining to the water that we are giving, whether at all water is actually reaching each and households is the biggest challenge that we are facing, which we need to come up with solutions. Operation and maintenance, definitely this is another area where we are all facing a lot of challenges, and this is the area where I feel there needs to be a lot of debate and discussion which should go on. And the last thing that I feel is the most important thing is what are the best chlorination technologies, disinfection technologies that we need to actually come up with, and also ensuring that such disinfection technologies are being implemented by the field staff. These also needs to be measured. I feel we should have a lot of discussion on all these areas in coming days, and I'm hopeful that we will have from Jal Jeevan Mission, Government of India, such platforms will be created so that we can discuss and debate and come up with solutions. Thank you so much.